Hi everyone, my name is Rebecca Farah. I am a student in the Nurse Practitioner program at Auburn University. I'm going to discuss today a healthcare issue that affects all of the United States. The discussion for this topic is going to be on the lack of or limited resources in rural areas within the United States. I'm going to discuss some of the contributing factors, some statistics related, the individuals that are affected, and also a potential solution to resolve the lack of healthcare in these rural communities. The target audience for this discussion is healthcare providers practicing within rural communities and also healthcare providers that are practicing in urban settings that are close to rural communities. So, individuals living in rural communities have fewer healthcare resources, and this is not just limited to primary care, it's limited for women's health, pediatric care, specialty services, and emergency health services, mental health services. The National Rural Health Association provides some statistics on how many healthcare providers there are in the rural setting as compared to the urban setting. The association found that 39.8 primary care physicians are in the rural setting for every 100,000 residents. And this is compared with 53.5 physicians in the healthcare specialty for 100,000 residents in the urban areas. So that's nearly 15 more per every 100,000 that are in the urban as compared to the rural areas. The association also found some statistics related to specialty services, and there are only 30 specialists for every 100,000 individuals in the rural population, compared with 263 specialists for every 100,000 in the urban population. So there's definitely a lack of providers that are caring for the patients in the rural settings. So along with the shortage of providers, there are some other factors that contribute to the lack or limited access of healthcare in rural communities. Some of these are that the population is found to be poor in the rural communities. There's geographical restrictions. People live really far from the healthcare facilities in their area. Some people, don't have employment, or maybe they're a farmer and they don't have insurance through a company like somebody may have if they live in an urban counterpart. It also found that individuals living in rural communities have more comorbidities. They have advanced disease progress, many, multiple diseases. So it's important to address the effects of the limited healthcare in the rural areas. And research shows that individuals living in these underserved rural areas have poorer health outcomes than their urban counterparts. So not only do these individuals not have access to just everyday resources that they may need, but they don't have access to preventative screenings and assessments, which this can lead to advanced disease progress upon diagnosis and even like delayed treatment. Additionally, those living in rural communities do not have access to emergency services. The National Rural Health Association found that more than 50% of fatal vehicle crashes occur in rural areas. And this is a big problem because those individuals may have had access to, emergency and life-saving measures if they had lived or their crash had occurred in an urban area. So the healthcare issue of poor access to healthcare in rural communities not only affects the population of the communities, but it also affects the healthcare providers that are caring for the individuals in those communities. The healthcare providers practicing in rural communities are often required to provide services for their patients that would typically be cared for by specialists. The healthcare providers are caring for patients that have multiple comorbidities. They have, diabetes, heart disease, mental health, and they're caring for all of this, where in the urban setting, these providers would have been, they would have referred this patient out to a specialist. The healthcare providers face many challenges with caring for such large and complex populations, and they also may encounter many ethical dilemmas. Most of the providers that work in the rural setting have close relationships with the community, so they have issues as far as like stress when they cannot care for a patient or a family member of a patient. Maybe the patient or that family does not have insurance, or maybe there's just some other ethical dilemmas that they have to face. Whereas in the In the urban setting, they would have, other places that they could refer them to. So for the provider that's caring for patients in this area, they have to take into account the population, the family dynamic, the financial, social, and economic status into consideration when formulating treatment plans. And a potential resource for these providers is the utilization of telemedicine. Telemedicine consists of utilizing technology to provide remote medical care. The implementation of the telemedicine within rural communities can be implemented with slight adjustments in training for the healthcare provider. Once the healthcare provider has received training on how to utilize telehealth, implementation can be immediate. Additionally, the telehealth can not only connect the healthcare provider in the rural community with their patients who have geographical restrictions, but it also can help connect those patients with specialists in their urban settings that are nearby. So overall, implementing telehealth in rural facilities is the goal is to improve the patient outcomes, decrease morbidity, and improve access to the appropriate health care. I hope you've enjoyed my discussion today, and hope you have a great day.